Good day everyone, I am Michael, the moderator for this webinar. I welcome everyone for today's webinar, which is Nursing Standards CMS Condition of Participation for Hospitals. It's a great pleasure for me to introduce our presenter for today, Laura A. Dixon. Laura A. Dixon, BS JD RN CPHRM, was COPIC's Director of Facility Patient Safety and Risk Management and Operations from 2014 to 2020. I would now like to hand over the floor to the speaker. Over to you, Laura.
Okay, and thank you very much, everyone. So just to go ahead and begin, we're going to be talking about the nursing standards within the CMS Conditions of Participation Manual. I've included both acute and critical access hospitals. Much of what's in the critical access hospital is repeated from what's in the acute, but I do want to present that so you'll have the slides available. How does this all work? The regulation, the law starts in the Federal Register, and then CMS puts and publishes the regulation, develops interpretive guidelines and survey procedures, and updates the manual. How does you keep up? You want to subscribe to the Federal Register. I have the link on this slide. This is slide number 7. Deficiencies. We can now access the deficiency reports. On the deficiencies we're covering today, on the topics we're talking about, so I've listed out by tag number. We'll go through these. Well, I do want to touch briefly on some changes that occurred in 2020. I also clarified that all nurses must follow policy and procedures, including agency, have policy and procedures preventing discrimination, and a policy that lists all outpatient areas where you have to have an RN. Some of the memos, first off, came out in 23. And then environmental risk. On the patient assessment, we have to be able to show as a hospital. On monitoring and staffing, we have to have enough, not only just enough bodies, but they have to be appropriately trained and educated. And then environmental risk. Another big memo that came out was on discharge planning. Again, July of 2023, but there were 6 main areas of concern. I do want to talk non-discrimination interpreters. So essentially, you have to have 2 signs. Section 1557 is part of the ACA. Now in 2021, Health and Human Service, that's OCR, said, look, we're going to interpret and enforce Section 1557 on discrimination on the basis of sex. These changes in 22 also enhanced the language assistance program for patients who don't have proficiency in English. You have to post a sign so a patient knows that they can receive interpretive services at no cost. The Office of Civil Rights, they have a document that lists them. Okay, let's move on to the conditions of participation. Overall, if you want Medicare and Medicaid funding, you have to meet all of the conditions for all patients, not simply Medicare and Medicaid. So overall nursing, I have the tag numbers in the upper right corner. The surveyor will talk to your chief nursing officer. As far as the director, there has to be a well-organized service for administrative authority, delineation of those responsibilities. There must be one nursing service hospital-wide. This is what immediate availability means. A surveyor will look at your schedules. They'll correlate the number to the acuity of patients. There have been 3 studies that did show adequate staffing means better outcomes. CIHQ, their staffing and safety, they did put out a 3-volume handbook for nurses. We have to have 24-hour nursing service provided or supervised by an RN. We have to verify licensure. We have to have an RN for every patient. We have to have a care plan for every patient. The interpretive guidelines say it starts on admission. The next tag number talks about assigning care. The surveyor will look at the assignments, make sure staff is qualified. When they included agency nurses, outpatient departments, medication administration is a huge component within the chapter itself. Now on medication errors, on medication preparation and administration, standing outpatient orders, the medical staff, they have to approve the policy and procedures on administration, policy and procedure requirements. Please do it during orientation and part of your yearly updates, whatever it is. Other basic safe practices and say the 5 rights, the right dose, the right route. There are 5 stages in the medication process. Literature that shows 9 rights. We also have to make sure staff follow standards of practice. ISMP, they have guidelines on IV push medication. First off, provide in a ready-to-administer form. So your eligible medications policy must include time critical. That's the first level. If you have a longer or shorter time, it's not going to really significantly impact that medication's therapeutic effect. Your policy also has to address what happens if it not given within that time frame. Of course, we have to monitor our patients. We have to look at the patient risk factors. Here, I've listed on slide 124 these risk factors. We have to look at these high alert medications. So again, medication administration is huge in that respect. Standing orders, verbal orders, but there are limitations, and there are 4 items that must be included in your policy. There were also 3 changes: orders and other practitioners, blood transfusions, IVs, patient monitoring. I've already talked briefly about some of those risk factors. They added it again. We want to make sure we have the right patient and the right product. Staff must be competent in venipuncture. 411 talks about reporting reactions. Now I'm combining home administration or self-administered medications. You may have to have your nurse supervise, include when supervision is needed. So for criticals, now I will say they do tend to survey acutes more than critical. RN has to provide nursing care or assign it. You have to have nursing leadership. They are responsible for the overall management and evaluation of care. You have to have an RN, LPN, a clinical nurse specialist, someone on duty whenever you have at least 1 or more inpatients. This is critical access. Supervision evaluation, as with acute hospitals, drugs and IVs, they're administered under the supervision of your RN. The verbal order policy at a minimum. Standing orders, all the additional policies for medication. Another item we have to look at is discharge planning. The nursing care plan. All right, I do want to talk about a couple other manuals that impact nurses. This is outside of the nursing standards. There are other sections. Nursing has to be involved in that because they're providing that bedside care. Does this patient have an issue that we need to notify radiology? Infection prevention and control.
Thank you, Laura, for the great presentation.
Thank you, everyone. Thank you for your patience. And Michael, thank you for your assistance. And those who participated, thank you, and stay well. Thank you.
Once again, thank you, Laura. So that does conclude the session for today. Thank you, everyone, for participating. You may all disconnect now. Have a great day ahead. Bye-bye.